Good day, Virgin Islanders at home and abroad. Welcome to the Government House Weekly Press Briefing and COVID-19 Update for the week of February 22nd, 2021. It is great to be back home in the territory and to be here today to provide this afternoon's update. I just want to mention to everybody, stay healthy. If our African American, West Indians especially, you know we don't like the doctor, please go. If you're over 50, get your colonoscopy done, get it on time. I took care of mine, painless, you could do it too. I have today with me the Health Commissioner, Justa Encarnacion, who will provide an update on the latest COVID-19 statistics and an update on where we are at with the COVID-19 vaccinations in the territory. Also joining us this afternoon is FEMA's Deputy Federal Coordinating Officer, Chris Allen. Before we get into our COVID statistics, I have an important announcement for our community this afternoon. After now 1 complete year into our response to slow the spread of the virus, and after 1 complete year of the hardships experienced by both residents and members of our small business community, we have reached a new chapter in our effort to keep our community safe. Many of you have heard the term herd immunity. And by now you are aware that the availability of at least 2 sections of the vaccine against the most common strains of the COVID-19 virus. Here in the territory, we have set a goal of vaccinating half of our population, or 50,000 Virgin Islanders, in that effort to achieve herd immunity. We have made steady progress towards that goal, with now more than 12,000 Virgin Islanders who have received at least their first dose of the vaccine. We have organized this effort through our phased structure coordinated thought, coordinated through the VI Government Department of Health, VITEMA, and our local health providers, which prioritize vaccinations to the most vulnerable residents first. We are now taking that effort 1 step further to allow the general public the ability to achieve and receive the vaccine in pursuit of our goal to achieve this herd immunity. Beginning on March 1st, that's March 1st, 2021, we will open 2 community vaccination centers in the territory, where all Virgin Islanders, I want to repeat that, where all Virgin Islanders will have access to receive a COVID-19 vaccination for a limited period of time. These centers will be located at the St. Thomas UVI Sports and Fitness Center for residents of St. Thomas and St. John District, and at the UVI Great Hall at the Albert A. Sheen campus on St. Croix. These locations have been selected as they provide the ability to reach most Virgin Islanders while providing convenient access for individuals with disabilities or access and functional needs. These community vaccine centers will be supported through the VI Department of Health, VITEMA, of course, VI National Guard, the Department of Defense, and of course FEMA. Here to discuss a little bit more about that coordination and all of the efforts that are being made in this cause by the government and FEMA to support, we will have an update from FEMA's Deputy Federal Coordinating Officer, Chris Allen. But before we turn things over to Deputy FCO Allen, we will hear from our Health Commissioner, Justa Encarnacion, about our COVID updates. As a reminder to the community, the VITEMA hotline to assist residents with scheduling an appointment to receive a COVID-19 vaccination is open Monday through Friday, 8 to 3 p.m., and the hotline number is 777-VAX, VACS, or 8227. Or you can also visit VITEMA's website at vitema.vi.gov. As of this morning, more than 1,700 people have utilized the hotline to coordinate their COVID vaccinations. But first, we'll go to Commissioner Encarnacion.
Thank you, Governor, and good afternoon, everyone. Before I start, let me just take an opportunity to thank Director Daryl Jashin from Vitima for collaborating so closely with the Department of Health, setting up the COVID, the call-ins number, and I will repeat the number as well so that you can, if you haven't written it down, please go on the website or write it down as we continue to discuss this with you today. As of February 20th, 2021, the Department of Health has tested a total of 46,380 persons under investigation, of which 2,579 have tested positive and 43,693 have tested negative. There are currently 89 active cases in the territory. 2,465 cases have recovered within the last year. However, 25 fatalities have occurred. We always pray for the families that have lost lives. From our hospitals, Wang Louis Hospital and Medical Center reports 0 COVID cases, and the Snyder Regional Medical Center reported 1 positive, non-vented COVID-19 patient. There are many COVID-19 testing options available. Our epidemiology hotline is still open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases of COVID-19. A full list of testing sites can be found online at covid19usvi.com/testing. covid19usvi.com/testing. We are also hosting pop-up testing events this week. St. Thomas at the Home Depot, Tuesday, February 23rd from 1 p.m. to 3 p.m., Thursday, February 25th from 1 p.m. to 3 p.m. St. Croix at the Candigator Recreational Center, Tuesday, February 23rd from 10 a.m. to 1 p.m. St. Croix at the Bodo Park in Frederiksted, Thursday, February 25th from 10:30 a.m. to 1:30 p.m. In St. John at the VI Port Authority Gravel Yard, Wednesday, February 24th from 1:30 p.m. to 4:30 p.m. All testing sites continue to report data to the Department of Health. We then report these numbers in our epidemiology report that you see daily. As we advance to phase 2 of our vaccination plan, testing is still critical, and so is taking basic precautionary measures. Frequent hand washing, good respiratory hygiene like coughing into your elbow, social distancing, and proper use of masks can and have proven to keep us all safe. We cannot give up even with our successes with vaccinations coming on board. Wearing a mask is one thing, but wearing a mask properly is another very important practice. According to the Center for Disease Control and Prevention's most recent statement on COVID-19 variants spreading across the U.S. mainland, a properly worn mask completely covers the nose and the mouth. Cloth masks should be made with 2 or more layers of a breathable fabric that is tightly woven. For example, fabrics that do not let light pass through when held up to a light source. Masks should be secured to the head with ties, ear loops, or elastic bands that go behind the head. If the gaiters are worn, they should have 2 fabric layers or be folded to make 2 layers. The one layer does not protect you as well as it should. Masks should fit snugly but comfortably against the side of the face. The better the mask is sealed to the face, the more germs it will block in and from the user. Remember, you wear a mask to protect yourself, but you also wear a mask to protect others. Mask should be a solid piece of material without slits, exhalation waves, valves, or punctures. For us to combat the COVID-19 pandemic, it will take a multi-pronged approach. Most of us have armed ourselves with the prevention measures I've listed, and now we have vaccines available to us that are 95% effective. The vaccines work to prevent severe illness and death, and we are working diligently to make it more accessible to many. With that said, we have opened up phase 2. Phase 2 includes those that are 65 and older, as well as all remaining essential government and non-governmental agencies that consistently face the public as they go about their daily assignments. As the governor indicated, the community vaccination centers will be open on March 1st and will bring us closer to reaching his goal to vaccinate 50,000 unique residents and attain herd immunity. Current doses given thus far, as the governor said, 12,869, 5,622 second doses, for a total of 18,491. We're getting closer. Individuals in phase 1 and 2 can make an appointment by calling 340-777-8227 or 777-VAX. It's important to remember that you must make an appointment to receive your vaccine at the CVCs. So please call the Vaccination hotline. Again, I repeat, 340-777-8227. And I have to repeat this, you must have an appointment to receive the vaccine at the CVCs. And that's in St. Thomas, at the UVI Sports and Fitness Center, and it would be in St. Croix at the Great Hall on the university campus. Once you get the COVID-19 vaccine, you should download the vSafe app. vSafe is a smartphone-based tool that uses text messaging and web service to provide personalized health check-ins after you receive a COVID vaccine. Visit vsafe.cdc.gov/. This app lets you report any side effects you may experience and can also remind you about your second dose. You are considered fully vaccinated 2 weeks after completing the second dose. Thus, that reminder is critical. With both Pfizer and Moderna, if you have your blood tested for COVID-19 antibodies once used, you should test positive for COVID-19 antibodies. Actually, I do. Do you, Governor?
I do too.
Think you do. Good. And if your body successfully mounted an immune response, it should be positive. The test result can be utilized for travel requirements for entry into the United States Virgin Islands within 4 months of the test result as an alternative to a negative PCR antigen test. That actually helps those that travel on a frequent basis. You don't have to always get a test if you are antibody positive. That's one reason why you should go out and get your vaccination. For more information on travel requirements, please visit USVIupdate.com. To keep up with the latest information, please visit the U.S. Virgin Islands Department of Health's Facebook page or our website, www.covid19usvi.com. And for COVID-19 health information alerts, text COVID-19 USVI to 888-777. And as I said, our hotline also is still available 7 days a week, and those numbers are 340-712-6299, 340-776-1519. I wish all of you a blessed day. Thank you.
Thank you, Commissioner, and thank you so much for that, because I know people are going to ask me, did you take a COVID test to get in to the territory when you left last week? Yes, I did. I actually went out, and that's how this question came up about frequent travelers. So if you're going away for 3 days, here's a reason to take the vaccine. You get it 2 weeks after your second dose. You will test positive for antibodies, as do I and the commissioner. And then you could travel back and forth for 4 months using that test once you upload it into the portal. So I got tested. I got a blood test before I left the territory, and that covered me in and out of the territory for the next month. Another good reasons why you should get your vaccine. And speaking of vaccines, we have with us FCO Deputy FCO Allen to tell us a little bit more about our community vaccine centers.
Well, first, good afternoon, Governor, Commissioner, and Virgin Islanders. In alignment with President Biden's national plan to respond to COVID-19 and the Governor's focus on vaccinating 50,000 people by July 1st, FEMA is working across federal agencies with the territorial and private sector partners to assist, augment, and expedite equitable COVID-19 vaccinations. The March 1st openings of the community vaccination centers on St. Croix and St. Thomas mark one more step in the unified effort between the territory and the federal governments to curb the spread of COVID-19. FEMA's partnership with the Governor's Office, the Virgin Islands Department of Health, Vitima, and the Virgin Islands National Guard will lead to success in the quest to defeat COVID-19. FEMA is supporting the territory with federal equipment and supplies for the U.S. Virgin Islands establishment of the 2 vaccination centers. FEMA has coordinated a mission assignment with the Department of Defense to support the Health Department's operations. Federal funding is available to the territory to reimburse costs associated with emergency protective measures taken by the territory to store, handle, transport, distribute, and administer vaccinations to reduce the spread of the virus. Even as we work to set up sites here and around the country, FEMA has a laser-like focus on equity. We are working with our territorial partners to ensure the USVI's vulnerable populations have the opportunity to receive vaccination at the community vaccination centers. FEMA Civil Rights and Disability Integration Advisors joined with the Virgin Islands Health Department, the territory's Americans with Disabilities Act coordinator, Vitima, and the Virgin Islands National Guard to ensure the vaccination centers will be accessible for all Virgin Islanders who make appointments for vaccinations. On-site language translations will be supported by FEMA through the use of translation phone line. Virtual sign language interpretation will be coordinated through FEMA. FEMA has supported the territory with its mission to defeat COVID-19 since the territory confirmed its first positive coronavirus case March 13, 2020. And we will continue to support the U.S. Virgin Islands before, during, and after disasters.
Thank you so much, Deputy FCO Allen, and we would like to publicly thank FEMA for their participation and support throughout the territory. We wish we could see them less because every time we show up, we're dealing with some new disaster, but thank you very much for the support. In other COVID news, we continue to process our stimulus checks to support our residents. This week, the Department of Finance, along with the Department of IRB, will have processed another 10,000 checks totaling $9.5 million going out to the public. If you have not filed your 2019 tax return, remember you have until Monday, March 15th to do so, or you won't get this extra 600 check. So please go out there and file. If you're not a regular filer, remember just put in $1 in there on the interest line and you'll be good to go. And if you're a Social Security recipient, you don't need to do anything. If you got the check before, we'll send you another check straight to your mailing address. Those should be coming out pretty quickly. The Bureau has established a hotline to assist in responding to the volume of calls due to the stimulus paychecks that we're putting out again. So if you have any inquiries, please call our hotline. It's 714-9325, 714-9325. We have managed to come this far as a team by ignoring the critics and following the data. Time and time again, we have been right in our decision-making and kept our people safe. Almost 1 year later, we still have to listen to the naysayers who doubt our approach to handling the spread of the pandemic. The proof is in the pudding. We know what to do, and we know when to do it. It's so often our intentions and our efforts are misunderstood by the public and sometimes by our own government personnel as well. There are two main items that I would like to address today that I'm hearing a lot of chatter about in the public. The first one is the beach closures at 4 p.m. on holidays and weekends and why we are still maintaining the provisions of this mandate. The beaches are not closed to parties and normal festivities because we want them closed. All of us on the COVID team and most of us in this Virgin Islands government grew up on the beaches just like you right here in the Virgin Islands, enjoying them and all the outdoor activities. The reality is, though, that as good as we have fared, we are in the midst of a global pandemic. Why are the restaurants and the bars open and the beaches closed? I see that asked time and time again in social media and as I make my rounds through the public. The simplest answer is these establishments, all these bars, restaurants, and other activities around, they have an established management. There is a structure there, a building or edifice or whatever, and a management team that helps us control mass gatherings and wanton behavior. You're going to like that word, right? Wanton behavior that create these super spreader scenarios. This is what we're saying. On the beach now, we don't have the same management and we don't have the help of all those bar owners, restaurant owners, managers, supervisors, waitresses to help us control the spread. There is none of this management there. And there are far too many beaches and places on the ocean for us, with our scarce COVID team, to manage all of those places and those areas. And to be frank, we all know what happens as the day goes on the beach and the bar gets lower and the drinking gets higher. People tend to be more friendly, forget about social distancing, forget to wear their masks, and forget that we are in a global pandemic. Our goal is to keep you safe, even from yourself. But the other reason that we do this is that all these bars and restaurants create livelihoods for their owners, tax dollars for the government, and perhaps most importantly, jobs for Virgin Islanders who would otherwise have problems paying their bills and providing for their families. We are aware that this puts a social hardship on our residents, but with your help as volunteers to take the vaccine, we can reach our goal for herd immunity and lift the curfews off of our beaches. 50,000, that is the goal. And we have to be able to do this so we can leave the beach at 4 o'clock and have a little control, or have no control on the beach and have everything shut down for 30 days as we have had before. Now, the other issue I want to talk about is the return to work of government employees. The reason why we issued this 2 weeks ago was to provide services to the people we serve 8 to 5, Monday through Friday. This was not a mandate to put employees in danger or to create hardships on you because your children are not in school and you don't have the child care you need right now. For an entire year, we have been operating on limited hours, whether it's 8 to 3 or only Monday, Wednesday, and Friday, or Tuesday and Thursdays, or only call-in service. Remember that while the government has done that, the majority of the private sector, including the schools, have had to operate at extra hours in an attempt to survive, make their payroll, and make ends meet. We owe it to our community to answer the phones and provide the services that they deserve and frankly pay their taxes for. The Virgin Islands government has a telework policy that has been implemented, not for COVID, but for perpetuity. It's not going away. The changes that we have made in government relations, all these changes, from online registration to virtual meetings, flex time to remote working, are here to stay. These are not temporary measures. Please utilize them to transition back to a workplace and a 40-hour work week. Inquire at your department individually or to your commissioner about these opportunities. But keep in mind, our mission is to serve our public first, and it has to be convenient to them first and to us employees secondly. Everyone is waiting for it to get back to normal. And many of us are failing to see the vast change that we have undergone in the last year, things are never, ever, ever going back to the way they were. Adapt and look for the new opportunities that are here today and face our new reality. We have faced many trials through this COVID pandemic, but we have learned so many new lessons. Let's put these lessons to work and really make the territory thrive. I want to let all you Virgin Islanders know that we have officially launched our Take Your Best Shot campaign to provide information on the COVID vaccine and how and when you can get it. And I want to make sure that everyone takes it, because this is what's going to bring us back to the closest we had of what we had before. And I would also like to thank, and I would be remiss if I didn't, for everyone for the overwhelming love, blessings, and well wishes for my 53rd trip around the sun. I had to turn off my phone because it was like it was getting a seizure. It just kept ringing and dinging for the entire day. So I got your message, and I'm trying to return all 356 texts. So bear with me. It may take me a few days. Every single day, I thank God for the richness of my life and the opportunity to serve the great people of this territory. We are truly blessed to live in such a wonderful place. Take time each day and celebrate your present, and focus on making every single moment of this short journey called life count. I'll take some questions from the press, and I'm sure my panel here will do the same. Questions from the press? Oh, we have Lasiba Knight from the Avis.
Hello, good afternoon.
Good afternoon.
Governor, Commissioner, Deputy Allen, and the listening and viewing public. I just have two quick questions, one for Deputy Allen. Sir, I was hoping to get some more information on what personnel is coming down for these vaccination clinics. I understand that it's 25 troops from New Jersey that will be staffing each one, and I'm wondering what hardware FEMA has provided that's going to be used at the centers, basically like a logistics breakdown of that. And then, Governor, I have a question for you. I was wondering if I can get an update on the emergency rental assistance program.
Yeah.
I understand that it's been funded up to $21.3 million and that the Housing Finance Authority is working through the guidance, and so I'm wondering, when people can start applying and that sort of thing.
We're trying to get it up within the next 2 weeks. Remember, it's really a landlord program. It provides rental assistance, but the checks will be cut to the landlords. So we're asking the landlords to please bear with your renters while we get this together. Remember, you can't just not pay your rent and we're going to pay it for you. You have to prove hardship, that you have lost your job and lost income. We're getting it together. We want to make it as quick and as efficient as possible, trying to see if we can get an online portal and some other people to participate so we can get this relief to our landlords as soon as possible. It also pays utilities, so if you have a utility concern, it can be used to pay that as well too. So if you owe WAPA, you need to start thinking about how you're going to put those together, get your bills together, your lease agreement and whatnot. For your rent, to make sure we're prepared to say. Deputy Allen?
Sure, I'll take the, I understand your question was concerning personnel support that we'd be providing as well as equipment. So it's true. So just like any disaster, when we receive a request for assistance, we process that request through the federal agency that's best prepared to support that request. In this case, it is the Department of Defense. And you are correct. I would say it's approximately 25 personnel right now. Don't hold me to 25. It could be 24, 25, or 26. Department of Defense is currently working through the sourcing solution. I think you mentioned they were coming from New Jersey. I can't confirm that. Again, Department of Defense comes up with a sourcing solution. The great thing about the folks that are coming out that are referred to as Title 10 forces is they will actually be working with the National Guard under the dual status commander, and those resources will be applied as the Virgin Islands sees fit. As far as equipment, we're still sort of working through that. It could be as simple as tables and chairs, maybe some information technology equipment, but the important point is that there's a joint task force consisting of Virgin Islands Department of Health and the federal response folks that work through this every single day on how to assure that on March 1st, there's mission success. So I hope that answers your question.
Thank you very much. I appreciate your responses.
Thank you, Lasiba. I just want to emphasize that little piece a little bit more. So while you're waiting on us to get everything right for this program to run, you're going to need things like a lease. A lot of you, I know you have leases that may have expired. You need to have a current lease without a doubt, copy of your light bill, proof that you lost your job, maybe some unemployment checks. If you have those to prove you have loss of income, your business license, if you're going to claim because your business has undergone stress, those people who have works in self-employment are going to need some sort of proof to show that, and all those documents are going to have to be current. Your landlord, their name, their mailing address, they're going to have to sign some forms, so kind of get them ready as well too. So these are the things that you can do in preparation, so when we press the start button, you'll be available. Next question.
Hey, good afternoon, Governor. Suzanne Carlson, Daily News.
Hi, Suzanne.
Hi. We're hearing there's been some mixed messages and confusion from the airlines travelers. I know of at least one instance where someone was told when they tried to book a flight that they were sort of reminded of all schools to apply to international travel. But then someone else, the same airline, said that they were just told to wear a mask. They didn't have to test and adhere to all that. So are you hearing similar things? Is there confusion? What's tourism doing to help clear this up?
So can you ask that question again? You're saying the airlines are confused about whether or not to wear masks?
No, airlines are sending out information, apparently, saying that a traveler has to get tested as if they were coming from an international destination or international.
Oh, to get back
So-
into the mainland?
Is that something that you're hearing or dealing with? Any confusion about what the airlines are telling travelers?
Absolutely. We've been dealing with that for a couple of weeks now since we put in the mandate, since the president has put up the mandate. But we've been working with individual airlines as we hear that. And usually what happens is that happens at the counter level, where agents at the ticket agent may not be familiar with what the requirements are, and they're confusing British and U.S. Virgin Islands. So we'll continue to work with our airline partners on that. But as far as airlines seem to be going well, we had 23 jets land in the territory on Saturday alone. I think people are complying and doing what they need to get here, but there is a little bit of confusion sometimes at the ticket agent level, and we've been dealing with that.
I appreciate it. And then, I mean, in terms of vaccination rollout, have there been delays or any backlog in calls? I know the hotline has been slammed, from what I understand, and the 3 to 5 day window has been extended. What's the current window for callback?
So we're actually trying to beef up and encourage more people to call the hotline because we're getting ready for these mass vaccination centers. I know Director Joshin is here in the audience, but I can make that available to you, but I'm not aware of any backlog or anything.
Well, if I may.
Sure.
We actually have, I think we've received over 1,500 calls into the center. However, we do have a little backlog, but I don't actually consider it a backlog. Like I told them, I look at this as an opportunity because we have our CVCs opening on Monday, so we're utilizing those numbers.
Right.
So those people who have been waited will be called starting today to get an appointment to come in next week or the week after next to be vaccinated.
I think she was referring to the callback backlogs, unless I'm mistaken. That's what I was talking
Well,
about.
they will begin to get their callbacks today from the call-in center. In terms of the providers, I have not heard about many backlogs in terms of the providers. I know there is a little wait being called back from the Vitima call-in center, and that is because they're working with the providers to be able to put them on the appointment. However, as of next week, you will be called from this week to come in next week. So I think that backlog is going to go away pretty soon.
Are there any other reports of spoiled doses, of canceled appointments, of people missing the 28-day window because of the provider not having FUW to provide a dose?
Well, let me say this. CDC has actually given us some leeway. They've said that you can actually receive the vaccine 4 days before and then 4 days after. And so there's some providers who were at one point in time scheduling within a 4-day window. And so we've actually we meet with the providers weekly. We actually meet with them today, which is an added meeting for this week. And we always give them reminders. And so really and truly, they should be scheduling you for your vaccine 21 day after if it's Pfizer and 28 day if it's Moderna. But you have a 4-day window. For some reason, if you miss your 21st or 28th day, then you have 4 more days to be vaccinated. So we have not been outside of that window. But if we miss and if we hear that they are scheduling outside of that window, we are definitely getting in contact with them as soon as possible.
The other thing, Susan, I think, thank you for asking that question, because we are not the 777 Vax line is not the register for all providers.
Right.
It's only, how many providers?
15%? 15?
15% of providers that we have. So if your GP or your health center, whatever, you can go directly to them as well too. Besides, because I think there are 31
providers.
So only a couple of those are on our Vax line. So you can still call your general practitioner to see if they are participating in the vaccine program.
Okay, my last non-big question, the data breach advice. Is there any information that can be shared about that? And I know they discussed it in executive session this morning, and at the meeting this morning, you talked about remote work and people wanting to still be socially distanced, but there's no public access available at the meeting. They've decided that everything's going to be in person again, so if you live on St. John, you have to physically come to the St. Thomas facility, and there was only an hour and a half of notice for this meeting, so I just wondered if you want to address that. Is there going to be some kind of blanket statement about the policy or how it's handled?
What meeting? What meeting?
I'm not sure what meeting you're speaking about. I can say this, and maybe you can clarify.
The meeting was held in person today, and there was no ability for anyone to participate remotely. I tried.
I can't hear you, Susan. Say it slowly.
The Port Authority meeting.
Oh, the board
okay.
meeting.
The Port Authority?
Yeah.
Okay. And you're saying that no one has access or not doing it virtually, and you can't access it virtually?
Correct.
I'll definitely give Mr. Dawa a call and check into that. Why is that? Because all the meetings are public. I was not aware that. I know committee meetings aren't public, but the regular board meeting is. So we'll check in to see why that is.
I appreciate it. There was only an hour and a half notice given this morning that there was going to be a meeting held at all. So it's not transparent.
Got you.
All right, I'll leave it at that. Thank you, Governor.
Thank you, Susan. Next question.
Yes, good afternoon, Governor. My name is USVI Consortium. Big question there. Clarity on the situation with the payments for landlords for rent. This is also commercial, because I heard you said if you own a business, you would need to provide a business license. So this is also for commercial entities who need rent assistance?
No, this is residential rental assistance. Remember, you still have other federal programs that allow for borrowing for commercial establishments to pay their rent, utilities, and whatnot.
Yeah, just a clarification on that. Is there any assistance for? Because I know in the measure there was some assistance for homeowners as well to aid with their mortgages. What is being organized right now? It does include mortgage?
Right now, we're focusing on renters, trying to get those renters paid. Most mortgages, the banks have made mitigation arrangements for that. And there are also a couple of federal mandates on mortgages, especially for those that are backed by Fannie Mae.
But is there funding, so does the government, did the local government receive funding to aid residents with their mortgage bills?
Not to my knowledge.
Okay. I want to talk about, so before I go there, Governor, let me ask about the total stimulus checks that have already been issued. I know you said 2 weeks ago 10,000, and then what is the total as of today?
So as of today, well, the checks are going out. I think 5,000 is going out this afternoon, and then another 4,000 later on in the week, 4,500. So as of today, 10,000. By the end of the week, we'll be up to about 20,000. There have been about 34,000 filings, individual filings for taxes in 2019 thus far. And of course, you have to add to those amounts the Social Security, which is around 8,000 to 10,000.
Okay. I want to talk a little bit about, and I suppose if the Commissioner of Health could answer this as well. I want to talk about herd immunity a little bit. I know, and I had this question and I heard you spoke about it for a little bit. But what I wanted to ask, so on the official data list here, we have about 2,515 persons overall in the territory have tested positive for COVID-19. You know, and then of course, most of those persons are healed right now. But there are other persons who probably never, they were never tested, but they had the virus, they were healed. I suppose the Department of Health has an estimate as to what percentage of the population probably had COVID-19 so far. Aside from the data that you know, aside from the folks who tested positive, do you have a number, a percentage as to what you think is the percentage of the population that has had COVID-19 and recovered?
Thank you for asking that question. I have to tell you that I sent that question to Dr. Ellis this morning. Is it the time for us to actually run antibody tests throughout the territory to establish the percentage of antibodies or immunity throughout the territory? I don't have that answer for you today, but with discussions with her, especially with the governor, and our 8 o'clock calls with the task force, we'll be able to let you know when we'll begin antibody testing territory-wide and then come up with that percentage for you.
So Ernest, nationally, I've read a couple of reports, and some use a factor as high as 4 to say from the number tested to who actually has been infected. So it could be anywhere from 10,000 down, but I mean, from our estimation, and I know we conducted antibody testing in June or July, and then we did it in March and April as well too, at the hospitals, and it was insignificant, so we stopped really doing it. And then you figure the last surge we had was August, so we had a little bit of a surge in maybe November. So people are more resilient, it seems, in the Virgin Islands to the strain that we have been exposed to. So I would figure that the most we could be is twice what we have, which would be about 5,000 people infected. But you know, best guess, I think that would probably be the most, about 5,000. But the data may show different.
And remember, we now have individuals who are vaccinated, so the inoculation is actually increasing. So it's very difficult to say what the percentage is. We can do a guess.
Right. And the question is too, because I'm going to lead up to the question I really want to ask. So, you know, some U.S. data is now stating that in October, up to October, November 2019, folks, COVID was already spreading. Right. And, some people would argue and say that, you know what, this thing has been in the territory since December 2019. Some folks would grasp that, they think they have the virus. And so why I'm bringing that up is my next question, leading up to what I really want to ask is, if you look a couple of articles on the U.S. mainland, scientists and doctors are stating that they expect the U.S. to have herd immunity by April, right? So about 150 million folks would have been vaccinated, and then taking into consideration the folks who have the virus already, then that total inoculation would be saturated by April. My question is, what is that number of vaccinated people? How many vaccinations is the Department of Health hoping to achieve by April? So then you could probably bring. I'm sorry. Right?
But Ernest, April 2022, not 2021, right? I think that's what you're referring to, April 2022, because there's no way the U.S. is going to get herd immunity by April. I mean, our strategy here has been that we're gonna create the scenario. We're unlike states, we don't have bridges and highways coming into our population. We essentially have the marine industry, which we have seen minimal entrance there, and then we have the airport, where we probably most of our COVID has come through. With the restrictions that we're putting on air travel now, we're hoping that we're going to see minimal COVID in the territory by June. That's why we have this 50,000 goal for June. But even now, I mean, you know,
50,000 goal of vaccinations by June.
yeah. So
July.
like even now, July. But even now, you could see how in the territory that our numbers are kind of paring down and have been paring down because we don't have to deal with the mix of a lot of people coming in. And as well, you know, our strategy is to avoid the variants too. So hopefully by July of this year, we're going to see really, really low code numbers. It's always been our goal as we set forth, restricting who comes into the territory. None of the other states except Hawaii have that privilege to do that. So we want to take advantage of that.
And so, well, they are saying herd immunity by April. You know, in the last month, COVID cases in the U.S. have dropped 77%. And so they are saying part of that is because of the vaccination that is going on. But not only that, that's a limited factor. Rather, a lot of folks who have the virus are healed and have produced antibodies. I suppose if you're saying by July we're trying to accomplish 50,000 vaccinations, and you know if you're to take into consideration data that the Department of Health will have gathered by then that would state how many folks who have the virus and develop their own antibodies outside of the vaccinations, you could easily have 60,000, 70,000 Virgin Islanders.
Agreed.
So that is what has been argued in the state that by April you will see that. But I just wanted to get an answer on how many vaccinations we're hoping to achieve by a certain period, and then I got that. So thanks for that. Lastly, I wanted to ask about, I know we sent some samples out to the CDC to determine whether any of the other variants have made it to the territory. Have we received that data back?
We have not received any positive results, so that's a good thing. We continue, as soon as we get any positives, we continue to repeat samples and send it to CDC. So thus far, we haven't received any positive variants.
Awesome. All right, Commissioner, Governor, thank you.
Thank you, Ernest. That's it for the questions today. We also want to say a big shout out to our president, who has actually extended 100% FEMA coverage on project worksheets for COVID all the way back to January last year, which is great news for us. A lot of money that we spent we'll get back. We'll be able to provide even more services for our residents. And in the meanwhile, remember, stay safe, stay sanitized, and stay safe, stay sanitized, and stay tuned for the Spanish version of this element. Great to be back home. Love you. Have a great day.
Social distancing, driving students to and from school is preferred. Temperatures will be checked before students are allowed on campus.
Masks are required while on campus and are a part of the school uniform. Observe safety signs for social distancing and other important information around campus. Desks will be 6 feet apart.
reducing the amount of students in one classroom.
Cafeterias will be closed. Breakfast and lunch will be served in classrooms or in a grab-and-go format.
You will have the option of going to campus some weekdays or staying at home to learn.
School will be different this year.
But if we do our part, learning is guaranteed.
This is June, 65 years young and a proud grandmother. I've been listening to the news and paying attention on how the coronavirus is affecting our islands and families. I just found out the vaccine is here and now available to seniors like me. I called 340-777-8227 and gave the operator some information. She was a real sweetheart. And she gave me an appointment for near my house. My granddaughter, Tara, is taking me this week. So, let your folks know signing up for the shot was quick, easy, and it saved lives. Remember, the number is 340-777-VACS. Choose to be a part of the solution. Make this your best shot against COVID-19. Get the vaccine.
Buenos días. Bienvenidos a la rueda de prensa semanal de la Casa de Gobierno y a la actualización del COVID-19 para la semana del 22 de febrero del 2021. Es bueno estar de vuelta en casa, en el territorio, y estar aquí para proporcionar la actualización de esta tarde. Hoy tuve conmigo a la comisionada de Salud, Justa Encarnación, quien proporcionó una actualización de las últimas estadísticas del COVID-19, actualización de los sitios emergentes de pruebas y una actualización sobre dónde estamos con las vacunas COVID-19 en el territorio. También nos acompañó esta tarde el oficial adjunto de Coordinación Federal de FEMA, Chris Allen. Antes de entrar en nuestras estadísticas COVID, tengo un anuncio importante para nuestra comunidad esta tarde. Después de un año completo en nuestra respuesta para frenar la propagación del virus y después de un año completo de dificultades tanto por los residentes como por los miembros de nuestra comunidad de pequeñas empresas, hemos llegado a un nuevo capítulo en nuestro esfuerzo por mantener nuestra comunidad segura. Muchos de ustedes han oído hablar del término inmunidad de rebaño y ya son conscientes de la disponibilidad de al menos 2 vacunas contra las cepas más comunes del virus. Aquí en el territorio nos hemos fijado la meta de vacunar a la mitad de nuestra población o a 50,000 virgen isleños en el esfuerzo por lograr la inmunidad. Hemos hecho progresos constantes hacia ese objetivo con más de 12,000 virgen isleños que han recibido su primera dosis de vacuna. Hemos organizado este esfuerzo a través de nuestra escalonada estructura coordinada por el Departamento de Salud de las Islas Vírgenes, Vaitima y nuestros proveedores locales de salud que priorizaban las vacunas a los residentes más vulnerables. Ahora estamos llevando ese esfuerzo un paso más allá para permitir al público en general la capacidad de recibir la vacuna en la búsqueda de nuestro objetivo de lograr la inmunidad. A partir del 1 de marzo, abriremos 2 centros comunitarios de vacunación en el territorio, donde todos los virgen isleños tendrán acceso por un periodo limitado para recibir una vacuna COVID-19. Estos centros estarán ubicados en San Tomás, en el Centro de Deportes de la Universidad de las Islas Vírgenes para residentes del distrito de San Tomás y St. John. Y en Santa Cruz, en el Gran Salón, Great Hall, de la universidad en el campus Albert Einstein. Estos lugares han sido seleccionados ya que proporcionan la capacidad de llegar a la mayoría de los virgen isleños mientras proporcionan un acceso conveniente para personas con discapacidades o de acceso limitado y necesidades funcionales. Estos centros de vacunación serán apoyados a través del Departamento de Salud de las Islas Vírgenes, el manejo de emergencia VAITIMA, la Guardia Nacional de las Islas Vírgenes, el Departamento de Defensa de los Estados Unidos y FEMA. Como recordatorio, la línea directa de VAITIMA para ayudar a los residentes con una cita para recibir una vacuna COVID-19 está abierta de lunes a viernes de 8:30 de la mañana a 3 de la tarde. El número de esta línea directa es 340-777-8227 o también pueden visitar al sitio web de VAITIMA en vitema.vi.gov. A partir de esta mañana, más de 1,700 personas utilizaron la línea directa para coordinar sus vacunas COVID-19. Continuamos procesando cheques de estímulo para residentes elegibles. Esta semana, el Departamento de Finanzas y la Oficina de Rentas Internas han procesado y enviarán por correo otros 10,000 cheques por un total de $9 millones. Si no ha prestado su declaración o presentado su declaración de impuestos para el año 2019, tiene hasta el lunes 15 de marzo para hacerlo y ser elegible para un pago de estímulo. Si usted no es un declarante de impuestos, puede presentar un formulario 1040 del año 2019 y anotar $1 en la línea que indica intereses. Para los beneficiarios del Seguro Social que han recibido su primer pago, en esta segunda ronda se le enviará por correo automáticamente, ya que la oficina tiene ya su información. Esta oficina ha establecido una línea directa para ayudar a responder al volumen de llamadas debido a los pagos de estímulo y las consultas de cheques de reembolso. El nuevo número de línea directa es 340-714-9325. Hemos logrado llegar lejos, ignorando a los críticos y siguiendo los datos. Una y otra vez hemos tenido razón en nuestra toma de decisiones y hemos mantenido a nuestra gente sana. Casi un año después, todavía escucho a los ingenuos que dudan de nuestro enfoque para manejar la propagación de la pandemia. Sabemos qué hacer y cuándo hacerlo. A menudo nuestros esfuerzos son malinterpretados por el público y a veces también por nuestro personal. Pero tengo 2 puntos principales que abordar hoy. El primero es el cierre de las playas a las 4 en la tarde todos los días, fines de semana y días feriados, y el por qué estamos manteniendo esta orden en nuestros mandatos. Las playas no están cerradas a fiestas porque queremos que cierren. Todos nosotros en el equipo de COVID-19 crecimos aquí en las Islas Vírgenes, al igual que tú, disfrutando de las playas y actividades al aire libre. La realidad es que no importa cuán bien hemos estado, estamos en medio de una pandemia global. ¿Por qué están abiertos los restaurantes y bares y las playas están cerradas? La respuesta es simple. Es que todos estos establecimientos tienen dueños que nos ayudan a controlar el comportamiento de reuniones en masas sin crear supercontagios. Sin embargo, las playas no están bajo tal manejo y hay demasiadas de ellas para nuestros escasos recursos de monitoreo. La otra razón es que todas estas barras y restaurantes crean medios de vida para sus dueños, dólares en impuestos y tal vez la más importante, empleo para virgen isleños que de otra manera tendrían problemas para pagar sus cuentas y proveer para sus familias. Somos conscientes de que esto pone en dificultad social en nuestros residentes, pero con tu ayuda, como voluntarios para tomar la vacuna, podemos alcanzar nuestra meta de inmunidad y levantar el toque de queda para nuestras playas. El otro tema es el regreso al trabajo de los empleados públicos. La razón por la que emitimos este mandato hace 2 semanas fue para brindar servicios a las personas a las que servimos de 8 a 5, de lunes a viernes. Esto no era un mandato para poner a los empleados en peligro o para crear dificultades porque sus hijos no están en la escuela y usted carece de cuidado de niño. Durante todo un año hemos estado operando en horas limitadas, mientras que la mayor parte del sector privado ha tenido que operar en horas adicionales en un intento por sobrevivir. Le debemos a nuestra comunidad en responder a las llamadas telefónicas y proporcionar los servicios que se merecen. El gobierno de las Islas Vírgenes tiene una política de teletrabajo que se ha implementado, no para COVID exclusivamente, sino para la perpetuidad. Los cambios que hemos hecho en las relaciones gubernamentales, desde el registro en línea hasta las reuniones virtuales, el tiempo flexible y el trabajo a distancia están aquí para quedarse. No se trata de medidas temporeras. Y por último, quiero agradecerles a todos el amor demostrado, las bendiciones recibidas y los buenos deseos de mi viaje número 53 alrededor del sol. Todos los días doy gracias a Dios por la riqueza de mi vida y la oportunidad de servir a la gran gente de este territorio. Estamos verdaderamente bendecidos de vivir en un lugar tan maravilloso. Tómese un tiempo cada día para celebrar su vida presente y concéntrese en hacer que cada momento de este corto viaje llamado vida cuente. Recuerde usar una mascarilla, practicar el distanciamiento social y obtener la vacuna cuando sea su turno. Tu mejor oportunidad contra el COVID-19 es obteniendo la vacuna. Gracias.